Fundamentals of Nursing HESI Review Questions. Question 1. A healthcare professional is caring for a client who is newly diagnosed with pancreatic cancer and has questions about the disease. To research, the healthcare professional should identify that which of the following electronic databases has the most comprehensive collection of nursing articles: Medline, CNAL, ProQuest, HealthSource. CNAL Cumulative Index to Nursing and Allied Health Literature is a comprehensive database that specializes in nursing and allied health literature. Question 2. A healthcare professional in an emergency department is assessing a newly admitted client who is experiencing drooling and hoarseness following a burn injury. Which of the following actions should the healthcare professional take first? Obtain a baseline ECG. Obtain a blood specimen for ABG analysis. Insert an 18-gauge 4 catheter. Administer 100 humidified oxygen. In a client experiencing drooling and hoarseness following a burn injury, airway compromise is a critical concern. Question 3. A client has unilateral paralysis and dysphagia following a right hemispheric stroke. Which of the following interventions should the nurse include in the plan? Place the client's left arm on a pillow while he is sitting. Provide total care in assisting with the client's ADLS. Encourage mobility and avoid bed rest. Facilitate feeding by placing food on the left side of the client's mouth when ready to eat. Placing the client's left arm on a pillow while sitting helps prevent shoulder displacement and assists in maintaining proper positioning and alignment. Question 4. A client is in a seclusion room following violent behavior and continues to display aggressive behavior. What action should the nurse take? Confront the client about this behavior. Express sympathy for the client's situation. Speak assertively to the client. Stand within 30 centimeters 1 foot of the client when speaking with them. When a client in a seclusion room following violent behavior continues to display aggression, it is essential for the nurse to confront the client about this behavior. Question 5. A client is receiving brachytherapy for treatment of prostate cancer. Which of the following actions should the nurse take? Cleanse equipment before removal from the client's room. Limit the client's visitors to 30 minutes per day. Discard the client's linens in a double bag. Discard the radioactive source in a biohazard bag. When caring for a client receiving brachytherapy, it is crucial to handle radioactive sources appropriately. Question 6. A healthcare provider is assessing a client who has left-sided heart failure. Which of the following should the healthcare provider identify as a manifestation of pulmonary congestion? Frothy pink sputum, jugular vein distension, weight gain, bradypnea. Pulmonary congestion is a common manifestation of left-sided heart failure. Question 7. A patient requires augmentation of labor. Which of the following conditions should the nurse recognize as a contraindication to the use of oxytocin? Diabetes mellitus, shoulder presentation, post-term with oligohydramnios, chorioamnionitis. Post-term pregnancy with oligohydramnios is a contraindication for the use of oxytocin due to the increased risk of uterine hyperstimulation and fetal distress. Question 8. A caregiver is caring for a 5-month-old infant who has manifestations of severe dehydration and a prescription for parenteral fluid therapy. The caregiver asks, what are the indications that my baby needs and for which of the following responses should the caregiver make? Your baby needs and for because she is not producing any tears. Your baby needs and for because her fontanelles are bulging. Your baby needs and for because she is breathing slower than normal. Your baby needs and for because her heart rate is decreasing. The correct response is A. Your baby needs and 4 because she is not producing any tears. Question 9. A client with heart failure has a new prescription for furosemide. Which of the following statements should the nurse make? Taking furosemide can cause your potassium levels to be high. Eat foods that are high in sodium. Rise slowly when getting out of bed. Taking furosemide can cause you to be overhydrated. Educating the client on the importance of rising slowly when getting out of bed is crucial due to the risk of orthostatic hypotension associated with furosemide use. Question 10. When creating a plan of care for a newly admitted client with obsessive-compulsive disorder, which of the following interventions should the nurse take? Allow the client enough time to perform rituals. Give the client autonomy in scheduling activities. Discourage the client from exploring irrational fears. Provide negative reinforcement for ritualistic behaviors. Individuals with obsessive-compulsive disorder often feel compelled to perform rituals to alleviate anxiety. Question 11. A client with depression reports taking St. John's wort along with citalopram. The nurse should monitor the client for which of the following conditions as a result of an interaction between these substances? Serotonin syndrome, tardive dyskinesia, pseudo-Parkinsonism, acute dystonia. When St. Question 12. During the assessment of a client receiving packed RBCs, which finding indicates fluid overload? Low back pain, dyspnea, hypotension, thready pulse. Dyspnea is a key finding indicating fluid overload in a client receiving packed RBCs. Question 13. When applying Nagel's rule, a healthcare professional is estimating a client's expected date of delivery based on their last menstrual period, which began on April 12. What date should the healthcare professional determine to be the client's expected delivery date? Use MMDD format. 119, 121, 115, 122. To calculate the expected delivery date using Nagel's rule, begin by subtracting 3 months from the first day of the last menstrual period, April 12, which results in January 12. Question 14. When discussing group treatment and therapy with a client, which characteristic should the nurse include as being a characteristic of a therapeutic group? The group is organized in an autocratic structure. The group encourages members to focus on a particular issue. The group must be led by a licensed psychiatrist. The group encourages clients to form dependent relationships. In therapeutic groups, the focus is often on addressing specific issues or topics. Question 15. A nurse manager is reviewing documentation with a newly licensed nurse. Which of the following notations by the newly licensed nurse indicates an understanding of the teaching? OOB with assistance for breakfast. Given 2 mg MSO4 IM for report of pain. Dressing changed QD. Administered 8 units of regular insulin subcutaneously. The correct answer demonstrates proper documentation by specifying the action taken, administered, the dose 8 units, the medication regular insulin, and the route of administration subcutaneously. Question 16. When caring for a client who speaks a language different from their own, what action should the nurse take? Request an interpreter of a different sex from the client. Request a family member or friend to interpret information for the client. Direct attention toward the interpreter when speaking to the client. Review the facility policy about the use of an interpreter. When caring for a client who speaks a different language, it is essential for the nurse to review the facility policy about the use of an interpreter. Question 17. A client in labor is receiving oxytocin. Which of the following findings indicates that the nurse should increase the rate of infusion? Urine output of 20 ml/hr. Montevideo units constantly at 300 mm Hg FHR pattern showing absent variability. Contractions occurring every 5 minutes and lasting 30 seconds. Montevideo units measure the strength and frequency of contractions during labor. Question 18. A public health nurse is managing several projects for the community. Which of the following interventions should the nurse identify as a primary prevention strategy? Teaching parenting skills to expectant mothers and their partners. Conducting mental health screenings at the local community center. Referring clients with obesity to community exercise programs. Providing crisis intervention through a mobile counseling unit. The correct answer is teaching parenting skills to expectant mothers and their partners. Question 19. A healthcare professional is preparing to administer an autologous blood product to a client. Which of the following actions should the professional take to identify the client? Match the client's blood type with the type and cross-match specimens. Confirm the provider's prescription matches the number on the blood component. Ask the client to state their blood type and the date of their last blood donation. Ensure that the client's identification band matches the number on the blood unit. When preparing to administer an autologous blood product, it is crucial to correctly identify the client to prevent errors. Question 20. During physical therapy, a client with Parkinson's disease makes the following statements. Which statement indicates the need for a referral to physical therapy? I have been experiencing more tremors in my left arm than before. I noticed that I am having a harder time holding onto my toothbrush. Lately I feel like my feet are freezing up as they are stuck to the ground. Sometimes I feel I am making a chewing motion when I'm not eating. Feeling like the feet are freezing up and sticking to the ground is a common symptom of Parkinson's disease known as freezing of gait. Question 21. A healthcare professional is reviewing laboratory data for a client who has chronic kidney disease. Which of the following findings should the healthcare professional expect? Increased creatinine. Increased hemoglobin. Increased bicarbonate. Increased calcium. In chronic kidney disease, the kidneys are unable to effectively filter waste products from the blood, leading to an accumulation of creatinine. Question 22. A client reports that the medication the nurse is administering appears different than what they take at home. Which of the following responses should the nurse take? Did the doctor discuss with you that there was a change in this medication? I recommend that you take this medication as prescribed. Do you know why this medication is being prescribed to you? I will call the pharmacist now to check on this medication. When a client reports that the medication appears different than what they take at home, it is crucial for the nurse to ensure the safety and accuracy of the medication being administered. Question 23. When teaching about electrical fire prevention at a community health fair, which of the following information should be included? Use 3-pronged grounded plugs. Cover extension cords with a rug. Check for tingling sensations around the cord to ensure electricity is working. Remove the plug from the socket by pulling the plug, not the cord. The correct answer is to use 3-pronged grounded plugs because they are safer and reduce the risk of electrical fires. Question 24. A charge nurse is recommending postpartum client discharge following a local disaster. Which of the following should the nurse recommend for discharge? A 42-year-old client who has preeclampsia and a BP of 166,110 mm Hg. A 15-year-old client who delivered via emergency cesarean birth 1 day ago. A client who received 2 units of packed RBC 6HR ago for a postpartum hemorrhage. A client who delivered precipitously 36 HR ago and has a second-degree perineal laceration. The most appropriate client to recommend for discharge following a local disaster in the postpartum unit is the one who delivered precipitously 36 hours ago and has a second-degree perineal laceration. Question 25. A healthcare professional is preparing to measure an infant's temperature. Which of the following actions should the healthcare professional take? Place the tip of the thermometer under the center of the infant's axilla. Pull the pinna of the infant's ear forward before inserting the probe. Insert the probe 38 cm 15 in into the infant's rectum. Insert the thermometer in front of the infant's tongue. When measuring an infant's temperature, the most appropriate and non-invasive method is to place the tip of the thermometer under the center of the infant's axilla armpit.